Welcome to the Mod for PH Research Highlights. This is a public health podcast produced by the National Collaborating Center for Infectious Diseases. My name is Wendy Xie, and I am a project manager at NCCID. In this podcast series, we showcase math modeling concepts and research for application in public health. This is the second episode in a 5-part mini-series highlighting the research and methods from the Artificial Intelligence and Mathematical Modeling Lab, or AIMM Lab, directed by Dr. Jude Kong at the University of Toronto. Joining us today is Sherif Shuaib, who is currently a PhD candidate in applied mathematics at York University and also serves as the coordinator of the AIMM Lab. His role is central to the lab's interdisciplinary mission, which bridges mathematics, AI, and real-world application in epidemiology, ecology, and data processing. Also joining us today is Dr. Yang Xu, who is currently a postdoctoral fellow at the AIMM Lab. Dr. Yang Xu holds a PhD in mining engineering from the University of British Columbia, complemented by a cross-disciplinary background in machine learning, minerals processing, and mechanical engineering. In this episode, Sherif will describe how his work aims to build capacity for AI and math modeling tools at the community level to advocate for community health and deliver collaborative solutions. And Yang and I will discuss how his background in models quantifying air quality led to his current work in the development of an explainable AI tool for epidemic modeling. Hello to everyone listening in. Thank you so much for tuning into this second episode of the Mod for PH podcast mini-series, which is dedicated to highlighting the research being done at the AIMM Lab. A huge welcome to Sherif. Thank you so much for joining us today to talk about the work that you're doing. Would you please introduce yourself to the listeners?
Hi, everyone. Thank you for having me, Wendy. So my name is Sherif Shuaib. I serve as the lab manager at the Artificial Intelligence and Mathematical Modeling Lab. Thank you for having me once again, and looking forward to our conversation.
No, thank you so much, Sherif, and I'm very excited to be learning more about your work in this episode. So would you please start by describing your role at the AIMM Lab and the project that you've been leading as a part of this team?
Okay, it's a very interesting question. So like I said, I serve as the AIM lab coordinator, or sometimes the manager. Basically what I do is to oversee daily operations within the lab. I also coordinate research activities in the lab, and I ensure our research, our work, just aligns with our mission of applying AI and math modeling to public health challenges. A key part of my role is capacity building at the community level, especially in undeserved communities. So I lead the student placement program at MLab, and what we do is to pair students with community-based projects solve real-world problems. With this program, we've been able to integrate students directly into community-driven initiatives. And in that way, we kind of ensure that our work and the research we do is informed by the community and also beneficial to the people within the community that is mostly affected too.
So this is incredible work that you and the team are doing, having student placement programs and building capacity from the community level and up. Could you provide some examples of previous projects from this program that have demonstrated capacity building for AI and math modeling methods, and how these projects have led to solving problems within communities?
Well, that's a very good question, Wendy. So the one coming to me now basically is one of the most impactful projects we ever did. And that was during COVID-19, where we examined the disproportionate impact of COVID-19 within the Jane and Finch community here in Toronto, which we consider as like the most socially vulnerable neighborhood in GTA here. That is the Greater Toronto area. So and this was done in conjunction with the Black Creek Community Healthcare Center. And they provided us with the data. And with the data, our team was able to kind of compare COVID-19 cases, hospitalizations, if I could remember, mortality, and healthcare access between Jane and Finch community and also the less marginalized areas. I mean, the key finding from this community project was that we noticed Jane and Finch experienced a very significantly higher COVID-19 cases, hospitalization as well, and deaths. And they also had a very low third dose vaccination rate. The team found that this might probably be due to the decline in preventive healthcare services within the Jane and Finch community. And one thing the research and this community project gave us is we're able to provide concrete evidence to the community to kind of self-advocate and kind of just understand that planning ahead and targeting public health resources and programming would be very key to kind of solve the issues within the community. Having said that, we also currently planning another project, right? And this time around, we were collaborating with Effie Gunness, which I mean, I think she's the Associate Director of Public Health at Toronto Public Health. So basically, what they are doing in this case is to develop an AI-powered system to monitor health-related risk during large public events in Toronto. And now, I mean, they're doing this because in 2026, there is the FIFA World Cup, which Toronto is one of the cities that will be hosting it. And in this project, what we are basically trying to do is to like provide early warning systems to potential public health threats. You realize that when there is a large event like that, let's say a concert, a lot of people come in from neighboring cities, but this is bigger than a concert. This is actually the FIFA World Cup. Like there are so many people going to be tripping into Toronto. So understanding what kind of outbreaks this kind of people would be subjected to, any weather-related illnesses or even substance-related harms would go a long way in planning for rapid interventions. So Toronto Public Health in this case reached out to us with, I mean, based on our antecedents, by working with us, by enhancing surveillance capacity, we seek to protect the public safety and also kind of support evidence-based decision making. And once we do this, I think this model can be applied to other future large events in Canada and even beyond Canada. So those are the two projects that quickly comes to mind when we talk about capacity building.
There's a lot of key collaborators and partners, including the student themselves and the community. What are some ways that you have evaluated the impact of this program for the people who have been involved? And would it be okay for you to share some of the results from these evaluations?
Yeah, I mean, that won't be a problem. So our evaluations, we do them in twofold. So for example, we do an individual evaluation and the community evaluation. Individual in the sense that we get a feedback from students, right, on how their placements have shaped their technical skills. I mean, sometimes the cultural awareness and their ability to communicate complex ideas, right? Mm-hmm. So many of the students have kind of reported an increased confidence in applying AI and mathematical modeling for real-world challenges. For the community evaluation, we ask our community partners whether they feel more capable of understanding and using the data in their own decision making. In several cases, right, some of these communities of it, or even these partners, so we call them, have now gone on to secure funding for initiative based on evidence generated during these collaborations. In addition to that, one other measure of success, I mean, especially for the students and especially as well for the community, is we try to encourage the students to have this project published in reputable journals, right? And now by publishing it in a reputable journal, what it does is it brings to light what is exactly happening with the community. So for instance, in the situation with the Jane and Finch community, we published the research and a lot of people, I mean, actually realized that, oh, this type of thing was actually happening in Jane and Finch. We also try to leverage our tools to the local health authorities to allow them to use them, okay, to kind of solve other issues as well, just to make sure that the sustainability of the partnership of the projects is just beyond a single project, as we would like to continue to support the community. So those are kind of the three ways we evaluate the programs individually, community level, and through published works as well.
Very exciting stuff. What
Mhm.
are some other ways do you think that we can build capacity for AI and math modeling for application in public health that's specific to Canadian communities?
So basically, I mean, and Professor Jude, we always talk about this, right? So I mean, for me personally, I kind of see our future works expanding in two different directions. One of the first would be strengthening the partnerships with the communities we've already worked with, right? Because it won't make sense just because we already worked with Jane and Finch, then we say, okay, we actually don't want to work with them again and just let them be like that. No. So occasionally we have students, right, who volunteer to be part of the Black Creek Community Healthcare Center. At least they support the students there, they support the community there. So that's the first way. We still keep on strengthening the partnerships with the communities we've worked with. And we're also interested in building new collaborations, right? This time around with other communities. Okay, let's use the indigenous community as an example. I mean, to do this, we want to just go to the community and start doing stuff. So, I mean, we don't operate that way, right? We have this memo where we start by actually even listening to the individuals within that community. So if, for instance, we'd like to partner up with the indigenous community, we start by listening with them. What exactly is the problem or are the problems they're facing? Then we learn from their traditional knowledge system. We also try to respect their data sovereignty, and we look into how we can co-create models that will actually reflect the community priorities rather than just imposing our own external agendas on them. So that is the two ways we are looking at in strengthening and building future directions, right? In addition to that, like what you touched on, we are equally trying to inspire and equip the next generation, right? And we also realize that AI has become like a topic, like a hot topic of interest. So we are launching the AI for Bright Futures, okay, which is a youth AI capacity building program where we try to catch high students at the very young age. And what we plan to do is to equip them with the fundamental, the ethics, and the real world applications of AI. And basically, this will be rooted in experiential learning. And what we hope to achieve is to uh, ensure that we provide access to resources for the students, mentorship, and leadership pathway so that these youths, I mean, who are either afraid of mathematics, right, can view AI and even mathematics as both a technology and a tool that can be used to solve their respective community challenges. Like I've said, we are not really looking to impose our own external agendas. No, we are working with the communities based on what the community need. So I mean, we're open to all youths from undeserved communities or unrepresented groups in STEM, and this could be the indigenous community, the Black community, or I mean, of any other historical underrepresented groups in STEM is welcome. Those are kind of the future directions we think we should go through to.
That sounds fantastic, and I look forward to learning more about that program when it launches. Thank you so much, Sherif. That is the end of our conversation for today. Thank you again for joining us to talk about the incredible work that you're doing, working with students and communities to build capacity for AI and math modeling methods, and sharing the ways in which this work has impacted individuals and their communities, and I think also wider, public health units, like you mentioned. So, do you have any final comments or other resources that you would like to share with listeners who are interested in learning more about this work?
I mean, what I would just like to share is, I mean, based off my experience with working with the student placement initiative, I realized that by just combining the technical skills within the lab, right, with the culturally grounded approaches available, AIM Lab aims to empower every individual to lead initiatives within the community themselves. Ultimately, we are building AI and modeling capacity in public health. And from the work we've done so far, this is not just about the technology, right? It's about the relationship. It's about the trust and the shared ownership of the knowledge we create. So I really do hope we'll have a lot of people come into IMLab. I mean, individuals from different communities come to IMLab to just kind of share with us what's problems they're having with their communities. We work together to see how this is solved.
Thank you so much, Sharif. As a former student who was afraid of math, it's very exciting to hear that you and the team with Dr. Ju Kong are building up this wonderful set of resources for students who may be interested in solving problems for their communities. So thank you once again for joining me, and I hope we get to chat again soon about your projects.
All right, Wendy, thank you so much for having me, and thank you to the listeners as well for taking their time out to listen to our conversation.
Hello, Yang. Thank you so much for joining us. As you know, we just had a conversation with your colleague Sharif from the AIMM lab about his work, and now we would love to hear more about the work that you are doing as a part of the lab. So again, welcome to this mini series. Would you please introduce yourself to the listeners?
Yes, thank you for your introductions. My name is Yang Xu, and I obtained my PhD degree in mining engineering in the University of British Columbia. And my background is actually across mineral processing and machine learning. So I'm currently a postdoc fellow in the AIMM lab, which we focus on two directions. One is on methane emission modeling by using AI and machine learning approaches in Canada, and another one is focused on using explainable AI techniques into the epidemic modeling in Canada.
Thank you so much, Young, for giving an overview of all the work that you're doing. And I know that in the timeline of your research at the AIMM lab, the air quality, the methane emissions, as you mentioned, that came first, correct? So
Exactly.
that's quite a shift in direction. So would you please give some more context about how you went from air quality modeling and AI to now epidemic modeling?
So yeah, in my methane emission project, I was using multimodal data fusion techniques that are trying to integrate the different kind of data sources, which may be including ground stations with very high accuracies time series data, which may be including like humidity, temperatures, PM 2.5, methane, or something about the pollutions materials. Another data sources is from the satellite imagery. So satellite imagery has its limitations. They maybe have a very low resolutions, but but with the broader, spatial coverage. So what we did is trying to combine each advantage of each kind of data sources and then training the models. And another novelty is trying to introduce this physical informed neural networks, which is trying to make the models predict the results that meet the physical laws. Because in our research, we review several articles. They maybe have the similar things that we did, but their models may have very high accuracies, but sometimes lacks of explainable about results. So that's is commonly we say it's a black box model. So what we did, trying to integrate the physical laws to make the models have the predictions reasonable. So that's is two novelties of my methane emission project. And then I transfer my experience with this two novelty into the epidemic disease modeling that we're trying to combining the explainable AI techniques with the mathematical modeling approaches. So the exactly things I did is trying to training a human behavior neural networks into this project. And then after that, we get the mathematical expressions that from the neural networks. And then our expert in the mathematical areas, they will use these mathematical equations to training the SIR model, which means a traditional mathematical modeling in the epidemic disease. And then the results will be explainable. So I think that's the novelty of my research.
So you mentioned a couple of key words. You mentioned black box modeling and the trustworthiness of modeling results, and how your current work in epidemic modeling using this new AI approach aims to address this issue. Would you please elaborate a bit more on what you mean by black box model and the results that come out of these models, and why it makes it difficult to apply the results from these models for public health policy?
So there is a very typical examples for a black box models. So I saw that some researchers training the models, they have the equations, but the equations is kind of like weird. So it's combining different mathematical symbols, but the expert or the researchers cannot explain why they got this results. They just use it to training their SIR models. And yes, they maybe have very like perfect curves to meet the SIR models, but they can't explain why they have very high, accuracies. But what we did is trying to use different kind of data sources. That is called multimodal data fusions. We use the hospital data, we use the vaccinations data, we use the policy data, and the case data. So that means the human behavior neural networks that we develop will be produce not only a mathematical expressions, but also the combinations of these different kind of data sources. For example, the result will be dominated by the hospitals. That means policymakers can see, oh, so when the hospitals volume is high, then the epidemic will be very serious. Then we have to make some policies to control this. So this is, I think, not only to achieve a higher accuracies of the models. So the models they did is actually a purely data-driven models. But we did is half and half. So it's data-driven plus explainable. So we can know the principles. So that is what we did.
I just have a follow-up question on that. So you're saying, the traditional model, it uses data-driven methods, and they've fit to the data to achieve a set of parameters. So then what is the AI part of what you've called a hybrid model? What is the explainable aspect of this hybrid model?
Yes. So my part is not actually make the predictions. My part is actually to trying to based on different kind of data sources to try and find their potential patterns. Which part will dominate the outcomes, the vaccinations, the cases, or the policies. When we got the combinations of these different features, we will build a mathematical expressions by using these features. And then we retraining our ISAR model, that is a mathematical model, using these results. So that means we may have a perfect fitting curves that's used from the SIR models, and we also can explain why this curve is perfectly. It's explainable AI techniques.
So you've already explained the novelty of your work. How do you envision the AI technology that you're building to be applied for Canadian public health moving forward?
Yes, so I think we currently in the preliminary stages. So that means in the future work, this technique will be used to train like a toolbox or a framework that with the more advanced or complexities of the abilities. And then because I just mentioned it's an initial stage, we have a lot of things to optimize the models. We're trying to use some feature engineering techniques to feature some unrelevant features, and then to remove the noises, to increase the equalities of the features. And then that's the next step. And after we got a ready to use the model, then we can train it, prepare it as a toolbox that it can be directly used by policymakers in Canada. Yeah.
Very exciting to hear about the applicability of this tool. So, from a policymaker's perspective, if you have a model, a traditional math modeling result that has used data to fit a set of parameters and produces a highly accurate output, but then you're bringing in this hybrid model and you're saying that it's an explainable model. If both models are, to me, as a policymaker, equally accurate, what advantages does your hybrid model provide
Okay,
for
I
the
see.
policymaker?
Yeah. So that's the one of the novelty of our outputs, because the results may tell the policymakers to see, oh, so when the next peak of the epidemic is coming, before that, you have to, focus on mobilities terms. You have to make some restrictions for people that not going out. You have to stay at home. That's the first priorities. Or you have to like the people to go to get the vaccinations. So that will tell the policymakers focus on which part of the features that is the first priorities. But not only tell policymakers, okay, our model has very high accuracies compared to the other models. The most important is still it's not a black box. So we can find the combinations of the features, even though the features itself, like the solo features, may have lack of the physical meanings, but after the combinations, they have the meaning. What we did trying to quantifying this expressions, and then the policymakers will do the right things. Yeah.
Do you have any final comments you would like to share with listeners, or any resources you would like to share if they're interested in learning more about your work?
So we'll make a little summary of my research. So what we did is trying to combine the traditional mathematical modeling and the advanced physical informed neural networks to make hybrid models that can either have very high accuracy of the modeling predictions, but also a strong explainable AI aspects. So we believe this will be used as a smart toolbox for the policymakers in Canada, and to make the predictions, not only the COVID-19, but also the other pandemic management in the futures.
Thank you so much, Young, and I look forward to the next steps in your work.
Thank you.
This concludes our conversation with Sherif about his work in building capacity for AI and modeling at the community level, and our discussion with Young about his work in developing a novel AI tool for epidemic modeling. Please stay tuned for the third episode in this 5-part mini-series highlighting the important work from the AI-MM lab. In the next episode, we will be speaking to Dr. Qing Han about her work in incorporating human behavior in models of COVID-19, and Dr. Abbas Yazinejad on his research in AI, machine learning, and privacy-preserving technologies. If you have any other questions about this episode or would like another math modeling concept or researcher featured on this podcast series, please write to us at nccid@umanitoba.ca. Production of this podcast has been made possible through a financial contribution from the Public Health Agency of Canada, but the views expressed here do not necessarily represent those of the agency. Learn more at nccid.ca.